Hello, am I audible?
Yeah,
Yes,
now
yes.
you are.
I was speaking without mic on.
Oh wow.
Okay, so the thing is, ma'am, biggest clue is in this question is hypercalcemia plus with no hepatosplenomegaly.
Yes,
In other conditions, na,
in multiple myeloma, we have basically two sign symptoms. Here is plasma cells and hypercalcemia.
hypercalcemia is also there. Plus there in the back or something like that. Ki exertional anemia. Basically, he is getting tired, na? Exertional fatigue. It is indicating towards anemia. Okay.
Sure.
And the hemoglobin is down. It is also indicating ki it is like having anemia. But as MCV is normal, so it is indicating it is normocytic normochromic anemia.
But why there is no lymphadenopathy? I think that in multiple myeloma we have a lymphadenopathy.
नहीं multiple lymphadenopathy ये MM ना doesn't include all this. No LL, no lymphadenopathy, no spleno, no hepato, कुछ भी नहीं होता. That is a big clue. You make it to a point. इसको भी कर लो. No splenomegaly. Never it happens. Or na when you come to know there is no splenomegaly. Basis on this na you can rule out the other two options. That is telling na that three option C or D you can take them out, because if marrow is not functional na, then these spleen or liver are used for RBC production. That
Sure.
means if that would be the answer na, then in question it shouldn't be there no splenomegaly. Then it should be given ki splenomegaly is present. Means if splenomegaly is present na, it is showing ki marrow is not working. They have left the marrow and they have chosen the liver or spleen for extramedullary hematopoiesis.
We should move next now.
Is like we can do one thing, like turn by turn we will read the questions na. Now
Yes.
you start her name.
Okay. A 43-year-old woman comes to emergency department with abdominal pain and dark urine. Physical examination shows right upper quadrant tightness without guarding or rebound. Verti 819 is decreased. And platelets, these are normal, and total bilirubin, I think,
Is raised.
this.
Yeah, it is raised. Very much
Okay.
raised.
And the lactate dehydrogenase is also raised.
Yeah.
And
And haptoglobin is reduced.
Sure. And a further workup, including MRI abdomen, shows hepatic vein thrombosis.
Okay. LDH is raised.
Which of the following
Hepatic vein
criteria?
thrombosis.
If hereditary secret circus, maximal PNU, intermittent porphyria. It could not be aplastic, I think. This explained.
Do you know, like all the options which are given in the like all the this lab tests which are given na, they are basically indicating that intravascular hemolysis is occurring. Okay, सबसे पहले. So based on that you can rule out the options in which extracellular hemolysis occurs na. So you skim that all in which extracellular hemolysis is occurring.
So it's not B.
Porphyria
It's not.
Yeah.
It's not B aplastic anemia. It's not.
Hereditary.
It could be hereditary, and it's still hemolytic.
Hemolytic तो है, but intravascular है क्या extravascular है? On the basis of that you have to skim, because
How do you
the
know
lab
it's
findings,
intravascular?
because lab findings are indicating towards that. And in case of extravascular hemolysis, they always give कि there is a splenomegaly. And all these finding na, if you go in FA, they have written कि all these are present in hepatos or this intravascular hemolysis.
So how are
And
the lab tests different for extravascular hemolysis?
yeah,
Like
this haptoglobin never raise in case of extravascular. This LDH will also not increase in case of extravascular. All these LDH and haptoglobin specifically, they are present in case of intravascular hemolysis.
okay.
देखो plastic anemia तो you can't say because platelets are fine ना, so you have ruled it
Yeah.
out. G6PD के लिए you know, like you should have some like ethnicity given or something related to the that G6PD से related you have some aggravating factors. Nothing is like that is present. So that is not
I think you had it disorder.
So you think it's E?
It is EE. Acute intermittent porphyria भी नहीं है उसमें because ना porphyria में as far as I can remember there is problem with skin pigmentation. Nothing like that is present.
Yeah, I think
E is the answer. और
hereditary
यार hereditary spherocytosis में ना this thing there is a specific like RBC मतलब spleno उसमें भी you have a
it's
splenomegaly.
extravascular.
Yeah, plus उसमें there will be given very like highlighted कि splenomegaly is there. Because spleen is the main problem in case of hereditary spherocytosis. Spleen will eat all the like abnormal spherocytes, and pakka say it should be there if it is that thing.
Sure. Okay, should we move next?
मतलब I guess porphyria में भी there is some bulle or like something like that is always present. So in that way we can rule out all of them.
The answer is approximately
PNH.
We have to just
Yeah. And the dark urine was also like dark urine. Na? It was also a clue for that PNH. Whatever I told about intravascular, na, it was right. Don't mix that. I was wrong. But this PNH is an exception. It shows both kind of hemolysis.
You were saying that it's an example of intravascular on the basis of
Yeah. In the basis of that only, na, I can make out it is intravascular. But PNH is an exception. It shows both kind of hemolysis. Plus now all these thrombosis and all is only found in this thing, PNH. Pigmented urine is due to porphyrin. Thromboembolism are rare. Elevated LDH. एथनिसिटी वाला कुछ नहीं दिया हुआ ना, मेडिकेशन एंड ऑल, वो मैंने बोला था, वो तो सही है. Make this also a point. Make this also a point, na? This
What?
thing. Make this also a point that hereditary spherocytosis have led to some symptom in this patient before age 43.
Patient objective.
Read it loudly, na, Hasnain.
Proximal nocturnal hemoglobinuria should be suspected in patients who have combination of hemolytic anemia, cytopenia, and hyperglycemic state. And intra-abdominal circular venous thrombosis. Flow cytometry tests are used to confirm the diagnosis by assessing the absence of CD55 and CD59 proteins on the surface of the red vessels. Should we move next?
Nidhi.
You can read. You can read.
Me or Nidhi?
We are together. No? She may have left. Or disconnected.
But she has left? No, it is
Yes,
saying 3 participants are there.
3 participants are we and
So she should-
undergraduate. We should continue one more person if she is not joining.
Yeah, but let her also join, na?
I'm just texting her.
Okay.
A 42-year-old woman comes to the office, the worsening abdominal pain and distension. The vague abdominal discomfort began 4 weeks ago. Abdomen has become progressively distended over the past weeks. The patient also notes several months of generalized pruritus, which is worsened by water contact and is not relieved by other counter emollients. She has no other medical conditions and takes no medication. The patient does not use tobacco. The temperature is normal and the blood pressure is around about raised. And the pulse is 88 decreased and the respiration is 16. The examination shows facial pleuriform and there is mild sclerosis. The neck veins are flat and higher hairstones along the abdomen is distended with flank. Dullness of the patient, tender hepatomegaly and splenomegaly. There's no extremity and edema or skin rash. Laboratories results are shown. Okay, hemoglobin 16. Hemoglobin is normal, no?
Raised है. Raised. इतना थोड़ी होता है.
16 normal. 12 to 14, no?
No, upper limit. It is raised very much. Hematocrit is also raised.
Normal value. 35. Hematocrit normal values. Leukocytes.
Yeah, actually, I don't remember. I divide it by 3.
Oh, sure. Okay, got it.
What I think so is every cell line is raised. Can you see leukocytes are like upper limit is 11,000. They are 12,000. Platelets are almost like very much raised. 4,000, like 4,40,000.
Bilirubin is also raised.
All this enzymes level are also very, very high.
And phosphatase level, these are also raised. It must have something to do with.
Yeah, everything is raised.
Next is options. That's the next step in the evaluation of the patient's abdominal pain. What is the best next step of this patient's abdominal pain? Abdominal pain would be due to diagnostic pancreatitis. It could not be cancer, no?
No. Screen chala gaya, Hasnain.
I think internet.
Okay. Now it's visible. Yeah, visible.
Diagnostic pancreatitis. Pancreatitis. I don't think so. Because he must have
Pancreatitis
given
नहीं है,
amylase.
paracentesis है. पैरासिंथेसिस है, पैंक्रियाटाइटिस नहीं है।
And chronic hepatitis serology for the evaluation.
नहीं यार, सीरोलॉजी
Hepatitis,
थोड़ी होगी।
he is may going for a hepatitis. Hepatitis C could have this.
पर उसमें ये सब थोड़ी होता है, सारी सेल लाइंस बड़ी हुई हैं।
Angiography, gallbladder involvement.
तो एनिमल में या तो ए है या तो एफ है, आइदर ए और एफ।
I'm just saying it. That's
ए एफ था ना।
because the patient acquires pruritus, facial diabetic elevated hematocrit base, and strong suspicion of anemia, chronic malnutrition marked by elevated X and mass
हसनैन, हम ये वाली मीटिंग बाद में कंटिन्यू कर सकते हैं?
कैसे?
वो जैसे अभी निधि नहीं है
तो कह रही है, वो कह रही मैं ज्वाइन नहीं कर पा रही।
क्यों?
वो कह रही तो मैं इस मीटिंग को ज्वाइन नहीं कर पा रही, एरर आ रहा है।
तो फिर हम इसको एंड करके दोबारा स्टार्ट करके देख लेते हैं।
तो मैं लिंक भेज देता हूँ, दोबारा स्टार्ट कर।
अच्छा जी।